Um, so I'm so delighted that you're here today. As I said, we have people in the audience from San Francisco to Ann Arbor, to Baltimore, to Philadelphia, to London, to Kampala. I think there might even be some Kigali and Johannesburg and Cape Town in the room. So thank you for being here on a Monday morning or a Monday evening. This book is a decade in the making, and I'm eternally grateful to the many individuals and institutions who supported this work over the years, especially the directors of the Uganda Cancer Institute, John Ziegler, Charles Olweni, Edward Mbide, and Jackson Orem. Jackson, I'm so happy that you're here today. Briefly, Africanizing Oncology is a historical ethnography of the Uganda Cancer Institute. This is a photograph of the Lymphoma Treatment Center from 1967. In the 1960s, the UCI was a small chemotherapy clinical trials facility. And today it serves a population catchment of over 40 million and is a center of oncology excellence in Eastern Africa. And the book is both a history of the UCI and a history of Uganda since independence. And when I started working on this book, I was very interested in conversations about new scrambles for African research subjects in the global health industry. And what was unique and what was different about the Uganda Cancer Institute was that it was a 50-year-old institution. Which had long used collaborative medical research as a resource for expanding cancer services for the broader Ugandan public. Now, many international partners have come and many international partners have gone from Uganda, but it was and it is ultimately Ugandans who keep experiments going and freezers operating. They provide care to patients on the wards of the UCI long after expatriate colleagues leave, or research results are published and funding cycles end. And a collective commitment to keeping things going, I think, explains the remarkable durability of this institution over the past 50 years. And rather than a case study of linear or rather than a case study of unilateral extraction, cancer research in Uganda was and continues to be generative for creating long-lasting cancer care infrastructures for Ugandan publics. So the book is arranged chronologically, and it pays keen attention to the stories of physicians, nurses, laboratory technicians, administrators, patients, families, and even the occasional politician who have lived and died on the wards of the UCI over 4 generations from the 1950s onwards. And the book really situates Africans at the center of biomedical research stories as knowledge producers, rather than simply bodies for extraction or experimentation on by white Western scientists. And this is a photograph of 2 of the Institute's directors. Here's Dr. Jackson Orem, and here's Dr. Charles Olweni at a public engagement 50th anniversary celebration for the UCI a couple of years ago. Now, this focus on Ugandan physician scientists might not sound like a radical intervention to anyone in this room. But I will say that 10 years ago, it did feel a bit radical to ask how African experts actually harness research collaborations to build and maintain care infrastructures for a broader public. Another interesting thing, I mean, Derek, you might be very interested to know that when I first started working on this history of the UCI a decade ago, some senior Africanist colleagues definitely asked me if I was really doing African history. And I think, and indeed, at one point in time, I gave a talk about the UCI at a prestigious university that will remain unnamed. And when we got to the Q&A, I was asked if biomedicine was a legitimate thing to be studying. in the health and healing of Africa. And my colleague, I'll mention, was very well versed in the historiography, familiar with therapeutic pluralism, the political economy of disease, the management of epidemics as a form of colonial power. But African physician intellectuals were not something they were prepared for. And I don't think they were prepared either for my obvious emotional and long-term investments in this project. You know, I was writing about a post-independence era biomedical institution. I was writing about pediatric cancer research that wound up being hugely beneficial to a local study population, as well as to international researchers. I was writing about a place that not only survived, but actually thrived under Idi Amin. And I was combining historical and ethnographic methods. So this is a photograph of the lymphoma treatment center, which is no longer standing. You know, but I worked here as a hospital ethnographer for a year. And I would suggest, and I hope that this is something that we could talk about, that there are ways in which this field has changed over the past decade that would allow for this admixture of time period, historical actors, a story of medical beneficence rather than exploitation, this methodological pluralism, a micro-historical focus on an institution. All of this is, I think, now a way that we can think about writing new African histories. You know, I haven't changed. I mean, I've changed a little bit in the past 10 years, but I do think that this is all very interesting. And I hope that we can discuss this biomedical term more generally in African health histories. Just a couple more things. I've been following the ongoing contemporary calls to decolonize global health with great interest, especially as unforgivable inequalities emerge with regards to COVID vaccination access across the global South. And I would suggest that there will be much for historians to do over this next decade to actually contextualize these discussions about contemporary calls for decolonization of global health. And I think that the history of the UCI is in itself an extraordinary case of decolonizing biomedicine and Africanizing biomedical expertise. And I'm just going to close with a couple reflections about audience, about readership, and about my own subject's position in writing this book. As again, I think that many of these decolonization debates really are going to be about the subject's position of historians and where we're coming from. And you know, there are many things I could say about being an expatriate white woman doing work here, and I'm very happy to address those questions in Q&A. But I'm just going to read from the text of the introduction here. Readers will engage with this book across multiple time zones, cultural contexts, and professional backgrounds. Many who read this account will no doubt be thousands of miles away from Kampala. They may never have had the misfortune of a cancer diagnosis or caring for someone with cancer. For many other readers, the stories within will hit a deeply personal nerve. And some colleagues, especially in Uganda, may feel that this book dwells a bit too much on some broken things, on a darker side of oncology and those who died rather than the survivors. And I have found that over the years, many who work at the UCI are the first to acknowledge that the Institute can be a tough as well as a miraculous place. Still, I'm well aware that it is a delicate matter when institutional challenges are described by a Mzungu, that is, a white person or a person who wanders, whether she be a journalist or a historian ethnographer. And despite my best efforts, there is no doubt some of the research and writing replicates knowledge production asymmetries of the white, expatriate, colonial, and post-colonial physician researchers I discuss in this book. Now, for other readers may decide I dwell too much on the good deeds of Ugandan doctors and too little on the suffering of strangers. But I'm reluctant to minimize the great bravery, the very definition of heroism involved in keeping the UCI open in the 1970s, or downplay the choice to come back to war-afraid Uganda after studying in the UK in the 1980s. Nor do I want to discount the bravery of patients to show up for medical appointments and endure harsh treatments, or the courage of a parent to prioritize a child over a marriage that then dissolves because of caretaking issues. So my attention to the courage and care of Ugandan health workers and knowledge makers is completely intentional. But my intentions are not Whiggish. African histories of medicine and the practice of oncology itself demand holding healing and harming in the same frame, as we know by reading Stephen Fireman, and more generally. This is not a story of linear progress, but one of multiple and overlapping cycles of creativity and crisis, repair and destruction, hope and despair. And I hope that you are moved. I hope that you are inspired, as I am, by the many stories of life and living at the Uganda Cancer Institute. There is much to learn from how Ugandan physician intellectuals, field workers savvy in forging friendships, resilient patients, and invested caretakers keep things going, be they buildings, bodies, experiments, kitchens, therapeutics, blood banks, or indeed optimism. So thank you.